Welcome to UF News on your side. We have just caught wind of a viral disease striking a path throughout the FSU campus. This disease is known as hand-foot-mouth disease, and it causes a painful rash on your extremities and around the mouth. Hand-foot-mouth disease is caused by an enterovirus, most specifically the Coxsackie virus or human enterovirus 71. The first recorded outbreak of this disease occurred in Singapore in 1970, and since then it has made its way across the entire globe. We will now go to Bao, who is on site at FSU, with a few students who have unfortunately come down with this disease and can give us some more insight into its symptoms and causes.
Thanks, Becca. I'm coming to you live from Backwash, that is Florida State University, where recent records indicate that over a dozen of hand-foot-mouth disease have been confirmed. With me, I have two FSU students, Bridget and Jordan. How do you guys feel about this?
Well, it's not great. Honestly, I thought it was just supposed to happen to babies and kids, and now look at me. I mean, how am I supposed to go out like this?
You sure it's not herpes? I mean, doesn't FSU have the third largest STD percentage in the country?
I mean, it's definitely not herpes because that was a cakewalk compared to this one. But the first day I felt really sick and really weak and just a little bit of a sore throat, but then I just honestly thought it was a bad hangover because it happened so frequently. And then the blisters came out of nowhere. There's this huge blister in the back of my throat and it's killing me just to talk to you. And then now it just hurts to just touch things and walk around, and I feel like I'm gonna die. I'm gonna die.
Dude, same here. When that happened, I just stayed in bed all day. I mean, my classes were easy enough anyway. Even that hurt though. I went to the clinic and they confirmed that I had hand-foot-mouth disease. They even confirmed I had mono. But there's nothing I can do about that, you know? It should be clearing up soon though. A lot of these blisters turn kind of dull and they're a lot less painful now. You look like you're in the early stages. Have fun with that.
So do you guys know if there's ever been any kind of administrative action from the university? Surely they would do something if so many of you guys have been affected.
Yeah, they told us to wash our hands more and to clean up our living spaces and our bathrooms, but I mean, we'll see about that.
Yeah, and I went to the clinic and they just gave me some UF hand sanitizer, so maybe that'll work a little bit better.
So anyway, how do you guys think you got the disease?
Well, I live with her and she got it first.
I mean, I could have got it from anywhere. I could have got it from touching the bathroom sink, or from doing homework, or from just being near someone.
Yeah, you probably just breathed on me. Anyway, they really just started cleaning the bathrooms and the dorms on campus. But I think the big thing that they told us was just to wash our hands.
So, well, there you have it, folks. Hand, foot, and mouth disease. So self-explanatory that an FSU grad probably name it. Thank you for your time, ladies and gentlemen. Just being around you two, I probably contract the disease myself, so I'm going to go wash up. Now back to the studio with Rebecca.
Thank you, Bao, for putting your own health on the line and getting the facts right from the source at FSU. It seems this disease is not any fun, but doesn't pose a serious risk to a person's life, which is good news. We will now go to Vivian with Dr. Kelsey Rose for a more professional opinion and some tips on what to do if you think you may have contracted hand, foot, and mouth disease.
Thank you, Becca. Vivian Mai here with Dr. Kelsey Rose. Dr. Rose is a pediatrician at UF Shands Children's Hospital and has seen many cases of hand, foot, mouth disease. Dr. Rose, hand, foot, mouth disease is a disease usually seen in children under the age of 10 years old, which makes an outbreak amongst college students quite surprising. How do physicians diagnose the condition?
Yes, Vivian. A majority of our cases are from children under the age of 10. Those who acquire hand-foot-mouth disease have common symptoms of fever, sore throat, lack of appetite, sores on their tongues and gums, inside of the cheek, rashes on their palms and the bottoms of their feet, and of course, there's the painful blisters on their hands and their feet. Since some of these symptoms can account for an array of other diseases, we use specific methods to diagnose hand-foot-mouth disease. Two of the main tests that we use are a mouth swab, a cheek swab, and also a stool sample. For both of these tests, we just take those samples to the lab and they'll take testing and they'll be able to analyze what germ we find in there. And from there we can definitely concur that someone has hand, foot, mouth disease.
Aside from the most obvious symptoms, the blisters, the symptoms are relatively common, but are there any treatments for these symptoms?
Well, in a majority of the cases we see, the infection will go away in around 7 to 10 days. Since the infection subsides on its own, we primarily only prescribe treatments that help to relieve the symptoms faced. Recommendations that I have regarding symptoms are consuming cold foods, definitely to drink plenty of liquids, and you can periodically take acetaminophen and ibuprofen to help relieve some of the pain, fever, and swelling that you may have. We also prescribe medicated mouthwashes to help relieve oral symptoms.
Even after the symptoms go away, there are other risks associated with hand-foot-mouth disease. These include being infected again by the same virus, becoming dehydrated from a decreased fluid intake, and possible development of meningitis and encephalitis. Can you explain what meningitis and encephalitis are?
Yeah, meningitis and encephalitis are considered to be a rare but sometimes serious form of the germ that affects the neurological system as well. Meningitis is an infection and inflammation of the membranes and the cerebrospinal fluid surrounding the brain and spinal cord, and encephalitis involves brain inflammation caused by a virus. However, like I mentioned, acquiring these are very rare.
With all the known symptoms and treatments, if someone believes they have contracted hand-foot-mouth disease, when should he or she contact a physician?
Your primary healthcare provider should be contacted if you can't eat or drink due to your sore throat, if you have mouth sores, fever, rashes that don't go away after 10 days. However, you should seek immediate care if you notice things such as lowered urine output, if you acquire severe headache and neck pain, you begin to feel confused or sleepy, or if you have trouble moving. Otherwise, if only generic symptoms are acquired, it is easy to treat the disease at home.
One last question, Dr. Rose. What are some discharge instructions you would give to patients who have hand-foot-mouth disease?
Definitely follow up with the course of the disease by following the treatment plan provided. Continue to drink plenty of fluids even after symptoms subside. And above all, help to prevent further spread of the germ by washing your hands and the surfaces very thoroughly and carefully, frequently.
Thank you so much for your time, Doctor. We hope that the infection does not spread further on the FSU campus or other college campuses around the state. Back to Becca in the studio.
Thank you to both Vivian and Dr. Rose for that informative interview. There is currently no vaccine in the United States for hand-foot-mouth disease, so do your best to follow preventative measures such as washing your hands and steering clear of other sick students to keep this illness at bay. If you find yourself with any of the previously mentioned symptoms, make sure to get yourself checked out right away and get back on the road to recovery. Thank you for watching UF News on your side, and stay healthy.